This is Carla Petrie on confocal microscopy. Confocal microscopes consist of a compound microscope with a laser for fluorophore excitation. The technique has been used to resolve the structure of numerous complex 3D objects, which include the networks of cytoskeletal fibers in the cytoplasm. Here's a diagram. The A slide is a blurred Drosophila embryo, unprocessed from a conventional microscope. On the B side is the crisp optical cells of embryo from a confocal microscope. Here you see how more clearer the microscope is with the confocal microscope. Confocal microscope manipulates the light before it is measured, so it's an analog technique rather than a digital one. Confocal microscopes produces optical sections by excluding out-of-focus light. It makes images more clear to see. And this image illustrates how confocal microscopes work. In the A illustration, the fluorescent specimen is illuminated with the focus point from a pinhole. On the B image, the in-focus light reaches the detector at the top. And on the C image, the emitted light from the out-of-focus point is out of focus at the pinpoint and it's excluded. So you're focusing on the image. Here is a case study on how nevoid melanoma, also known as NEM, is an uncommon subtype of melanoma. NEM can mimic the morphology of an intradermal nevus. This is a case for NEM that clinically mimicked an intradermal nevus. In this case, a female, 75-year-old female, came to a clinic seeking another opinion regarding two melanomas on her face. Here is an image of both of them. On the A side of the image was the clinical image that shows the 9mm brownish pink, slightly millimeter lesion. On the B image is a dermoscopy image showing the atypical vessels and irregular globules. So it was showing that it was a little bit different, but they couldn't exactly see what the difference was. So they did a RCM, which is a reflectance confocal microscopy, was performed to narrow the differential diagnosis by confirming what the nature of the other lesions were. And the image at the bottom right-hand corner is the image of the confocal microscopy mosaic of a nevoid melanoma of the B slide. And it did confirm that it was the nevoid melanoma and not the same as the A one, the A slide. But it does show that although RCM has shown high results for diagnosing melanoma, NEM has been reported as a potential diagnostic pitfall for other things. So not always a great diagnostic on all things. So that is one of the bad things of uh, the gnome. So the question that I think should be answered for this is, if the confocal microscope gives a clearer and a better picture of what's being magnified, wouldn't it be more cost efficient to just use this in doctor's offices or hospitals instead of having patients be under a microscope multiple times?